Hello, I'm Dr. Valerie Walker, and I'll be your host talking to you today about heart disease. Did you know heart disease is the number one killer of everybody in the United States? It's our number one killer. In fact, over 850,000 Americans will have a heart attack this year. So when we think about our heart health, do we go back to Sanford and Sons? All of you, now I'm not trying to bust you out on your age or anything, but most of you remember Sanford and Son when he talked about, oh, Elizabeth, whenever he got upset with Lamar, he'd always say, oh, Elizabeth, I'm on my way, Elizabeth, I'm coming. And it's this big drastic event. But guess what? That is just not necessarily always the truth, because a lot of times a heart attack can happen, and guess what? You don't even know it. I've had patients that I've diagnosed a heart attack in, and I read the EKG, and I said, Miss So-and-so, do you know you've had a heart attack? And they go, no, nobody ever told me I had a heart attack. And they'll say, you know what I think, Dr. Walker? They'll say, maybe I think it was that time when I was upset and I went to bed because I had some real severe gas pains and all, and that could have been it then. But you know who have heart attacks that are actually silent and they don't even feel it is diabetics. So you have always got to pay attention to your heart if you are a diabetic. So what is a heart attack? I mean, does a heart come under attack? What exactly happens in a heart attack? Well, what happens is that the heart is itself, even though it's responsible for pumping out blood throughout the body to make sure we get all the nutrients and the fluids and everything we need, that's its job. It's a pump. The heart itself needs nutrients and things to keep it going too. And whenever the heart is deprived of oxygen or anything, it can damage the muscles in the heart. And that's what we call a heart attack. So just the heart just coming under attack like somebody just going in beating the heart up. No, it usually comes when the heart itself is deprived. And it can be deprived from a numerous amount of conditions. But what we want to limit this talk to today is coronary artery disease, cardiac arrhythmias like atrial fibrillation, where the heart does all these weird kind of beating things that they do, and heart failure. So for the purposes, that's what we'll be talking about. Coronary artery disease, heart failure, and cardiac arrhythmias that can damage the heart and can cause you problems. So what is the heart? Is it this big structure that most people look at? Like you see cars and stuff, or people say, oh, they have such a big heart. Well, the heart, guess what? It's not big. I want everybody out there watching right now to ball your fists up. Ball your fists up right now. I need you to do that. Do you know that the human heart is the size of your fist? So it's not this big huge thing sitting up in your chest, and this is just about the size of the human heart. It's the size of the fist, but it carries a big punch because the heart has the function 24 hours a day, 7 days a week. It never goes on break. It never goes on a vacation. Whenever the heart goes on a vacation, guess what? You go on one too, but it's probably one of those permanent vacations. So it's a small organ, but you want to keep it healthy. Actually, the biggest organ in the human body, guess what it is? It's the skin that protects you from all kind of things that invade your body. It's one of the biggest components of the immune system, and we're going to do shows on skin disease and disorders and all. But the heart is a small thing sitting up in your chest that has to beat. It cannot stop even when you sleep. The heart has got to keep on going. So you want to do everything to keep that heart nice and healthy. So let's talk about who's at risk for heart disease. Who gets heart disease? Well, guess what we found out? We found out that every American this is according to the CDC, this is the Centers for Disease Control out of Atlanta, Georgia, where I'm from. Most people know I am a Georgia peach. I am from Georgia. So the CDC, they set standards in health, and they let us know all kind of things that's going on, statistics and why. They said that over half of all Americans have at least one of these 3 risk factors that set them up for heart disease. So if you sitting in a room with 3 people, kind of look around at them, like suspects, and know that one of them got one of these 3 things. They either got high blood pressure, they got high cholesterol, or they are a smoker. And that's 1 out of 3 Americans. That is a lot, and that's according to the CDC in Atlanta, Georgia. So these are the things that you have really, when I talk about staying on top of your ABCs, in a little medical minute we're going to do, you're going to have to stay on top of your ABCs. And for sure, I'm going to say this a lot during the program, if you smoke, that's one of the biggest things you can do for your health, is try to come off of those cigarettes. Okay? So, what are the symptoms? What are some of the symptoms that let you know that you're having a heart attack? Like I said before, it could be something big and dramatic, but usually it's subtle. And guess what? You're going to hear a lot on these shows when we talk about what are the risks of certain things. A lot of the risks is what I said before, nothing. You feel fine. You feel like the $1 million man or woman walking around all day. Nothing is wrong with you until you have some big catastrophic event, because you have not been keeping up with your health care. But if you do have symptoms, a lot of times it's chest pain. And the chest pain can be sharp, it can be dull. A lot of patients say it radiates down their left arm. A lot of women, especially women, this is something I noticed. Women with heart disease a lot of times will say the pain radiates up in their jaw area. So that can be one of the risks too. You could be sweating a whole lot. You could feel cold and clammy. It's just a very uncomfortable feeling. Patients who've had heart attacks, it's the most weirdest, uncomfortable feeling they ever had. You could be short of breath. Once you start getting short of breath and grasping for air and all, it's time to call 911, because this thing has got very serious and it is not good. Diabetics, like I said, could have silent heart attacks. It's almost like, diabetics, the reason why we always tell you to check your feet and all, you can have something wrong with your feet. One time I had a patient had a nail stuck in his foot that had been in there for months, and he was going to work every day. He was not checking his feet, and he did not know that nail was there. So sometimes, because diabetics are prone to all these conditions that can affect their nerves, neuropathies, and a lot of times they don't feel a lot. Sometimes they feel it's burning, tingling, all types of things. You want to really, if you're a diabetic, stay on top of your health care and ask your doctor. Always, everything you hear here, always check with your doctor to see if it's anything else that you can be doing to decrease your risk of having heart disease. You could feel real weak. You can have indigestion problems like I've talked about before. You could break out in cold sweats, and also all kind of symptoms, like I said. But the biggest thing you need to remember, just don't wait around, because sometimes you may not have any symptoms at all. All right, so let's talk about some of the things that we can do. I want to really go over in this show what we can do to get you from getting there. That's going to be a lot of this is prevention. We got treatments for everything now. You all see we can just treat, but a lot of medications have side effects. So what I want our show to gear toward is how we can prevent a lot of these things. And the first thing and foremost is always, again, exercise. I cannot tell you enough about exercise, because guess what? Your heart is a muscle. Your heart is a muscle. So just like men and women go in the gym and they pump iron and get all this good strong muscles going, well, the heart is the same way. When you exercise the heart, you gain muscle strength, cardiovascular fitness, so that if the heart does come under attack, it can withstand it. It's like if you exercise and somebody come in and poke you and punch you in the stomach, and you all fit and in shape, when you poke them back, it's not going to be fun. They're going to be flattened on the floor somewhere. So the heart is the same way. It's a muscle, and it need to be exercised just like the rest of your body. That's number one. The other thing you want to do is make sure you try to eat healthy. Now, the diet I recommend the most for my patients is called a DASH diet. This is a dietary approach to stop hypertension. And also the Mediterranean diet, they're sort of similar, but what these diets do, they focus more on fish. Do you like fish? Try to eat fish at least 2 or 3 times a week. The more the merrier. Some of the fish that you could eat that's good for you is salmon. And I know a lot of you like salmon. Trout. A lot of you had not tried trout. Trout was my father's favorite fish, and my mother could bake it so well. Mackerel, that is good for you. And all these things are good because they have a substance in it called omega-3s. And these are fatty acids that are very good for you. So you want your omega-3s. So next time you're in the grocery store, go by the fish market and try to eat more and more fish and incorporate it in your diet. So you one of them people to go, oh, Dr. Walker, I don't like fish. Fish don't like me. Oh, it likes you. You just don't like it. I can't get with the strong taste, etc., etc. Well, then there are other things that you can get omega-3s from. Things like nuts. And want to know a very good nut that's shaped just like the brain? A walnut. So eat more nuts, more soybeans. All these things can also give you some omega-3s. So you want to try to eat healthy. So you want to exercise. You want to eat healthy. The other thing you want to do is get your proper sleep. Like I've alluded to many times on this program, sleep is one of the number one things that eludes us now. Most people are not sleeping. And you know why you don't sleep? You don't have peace of mind. The best sleeping pill is peace of mind. You go to bed and your mind is racing, racing, racing. But you're going to need at least 6 hours of sleep or more every night, because research has shown people that sleep less than 6 hours every night, guess what? They're 2 times more prone to a heart attack. So you've got to get your proper rest at night. The other thing that you want to do is if you snore, and if your mate telling you that you running them out the room with that loud snoring every night, get that checked out, because that is not good. There may be something going on that you need to get checked out. You may have this thing called sleep apnea, and sleep apnea is hard on the heart because periodically during the night, guess what you're doing? You stop breathing. Yeah, and I've had patients record their spouse and all that have actually just stopped breathing, and then they'll believe they got it. Well, I don't want to sleep with that CPAP machine on. I look like a monster. Well, you're going to look like a monster in the coffin too. So yeah, let's put that CPAP machine on, and let's just get control of this sleep apnea kind of thing that we can have going on. You want to stop smoking. Again, you'll hear this forever on the show. Lay the weapons down. Every cigarette you smoke, boom, you nailing a nail in your coffin for every one that you smoke. So you want to get rid of that. You want to avoid alcohol at all costs. But if you must drink, and if you just drink it at your birthday and just every now and then, it's okay, because ladies, you can have your 1 drink, and men, you can have your 2. So that will be okay too. So you want to limit, avoid alcohol altogether. You want to decrease the salt in your diet. I usually tell my patients 2,000 milligrams a day or less, or if you have some kind of conditions where we have to lower it even lower, your doctor will do that too. So make sure you talk to your doctor about that. The other thing that you want to do is manage your diabetes. Always know what your hemoglobin A1C is. You always want to keep diabetes under control, because guess what? Diabetes damages those blood vessels. Those same blood vessels we've been talking about, diabetes damage those vessels. So you want to keep your diabetes under control, and you always want to know the hemoglobin A1C. The American Diabetic Association likes the hemoglobin A1C under about 7, but I tell my patients the closer to 6 is fine with me. Not hurting my feelings at all. And the biggest thing too you want to keep out of your life is stress. Stress, I like my book said, a dirty dozen, number 1 killer of every everybody is stress. We are such a stressful nation. We worry about things haven't even happened yet. I have patients tell me they're worrying about something going to happen next year. I suspect, Dr. Walker, next year I may be homeless. Well, next year we all may be homeless. Let's stay in the present. Let's don't go that far into the future. In fact, we used to say live day by day, but I changed it. Guess what I want people to do now? Let's just live moment by moment. All we got is this moment right now. We don't know what's going to happen in the next hour, but we do have this moment right now. And the last thing we want to pay attention to is because we eat out so much. Oh my God, you all are burning those restaurants up, and that's good for business and all. But when you eat out, show some kind of restraint. Don't go in there and order everything on the appetizer list that's all fried that you don't need to do. Try to stick with foods that are baked, that are broiled, that are grilled when you go. And when you order your salad, don't order all that fattening salad. Ask them, do they have a nice little low-fat vinaigrette? And I know y'all go, oh, low-fat vinaigrette, that is good. It's actually very, very tasty. And I'm really finna hurt your feelings now. When it comes to dessert, instead of ordering a big old hunk of chocolate cake with ice cream on the side, order yourself a piece of fruit. That'll be a good dessert for you to have at the restaurant. Then you've survived going out, eating out, and it wouldn't matter if you went out to eat more if you was eating healthier. Now, for its treatment for heart disease, we got all kind of things, but we won't emphasize a lot of treatment on the show because that's between you and your doctor, but we can tell you what's out there. Whenever you have problems with your heart, whether your coronary arteries are clogged, whether you have a arrhythmia like atrial fib, congestive heart failure, trust me, we got tons of medications out there that can treat you. You can do things like get a stent placed. You can also have bypass surgery. So there are all kind of things that we can do medically, but what I'm trying to do is get you before you get to those points. So in order to stay heart healthy, you need to eat heart healthy, you need to exercise, lay those cigarettes down, decrease the alcohol, and try your best to keep a happy, merry attitude. This has been Dr. Valerie Walker, and this was the medical moment on heart disease. We'll see you next time.